Hi, my name is Michelle Shapiro and I'm an integrative functional registered dietitian, and I am so happy you're here. Today, we're going to talk about exactly how you can walk into a doctor's appointment feeling good and walk out feeling even better. This is your guide on how to walk out of a doctor's appointment without feeling like crap. The goal of walking into every single doctor's appointment is to feel better than when you walked in by the time you leave. So today, I'm going to walk you through exactly how to do just that. How to leave every single doctor's appointment and not feel like crap, but feel amazing and like you were heard, seen, and you're more on your path to healing. And I know I've had this experience myself, and I'm a healthcare professional, so I can imagine that and have heard from so many of my clients this same experience. Shockingly enough, medical appointments are not intended to be a competition between you and the practitioner. The goal is really to get you feeling better. So my goal today is to help you find the exact tools you need to make sure that every single appointment is productive and that you don't feel like crap when you leave. I can hardly put into words the pain of being vulnerable with someone, telling them exactly how you're feeling, words that you've never told someone before, and honestly begging for answers and being met with complete dismissal or shaming in response. It makes patients like you feel insane after leaving an appointment. And what you deserve in every single appointment you go to is compassion and support. There is not one appointment you go to where you should not leave feeling better than when you walked in. I want to tell you a little bit about my story through the navigation through the medical system, because I feel that it'll help you to understand a little bit better why I'm so passionate about helping clients feel better in every single appointment. When I was 18 years old, I rapidly lost, and this is a trigger warning if you have an eating disorder, close to 90 pounds in a really short period of time. And I did that under the guise of a vegan diet, when really all it was restriction and deprivation. Directly after losing weight, I started to experience anxiety and gut issues, stomach aches, nausea. My hair was falling out in clumps. I had joint pain. I had extreme acid reflux. I felt dizzy all the time. I had vertigo, lack of focus, and just overall felt bleh. And when I think back on it now, that timeline really lined up almost perfectly from the moment I lost weight. So I wanted to figure out what was wrong. I bounced from appointment to appointment trying to get answers, and I was just met with a laundry list of diagnoses and medications. You have low blood pressure, you have clinical depression, you have panic disorder, you have hypoglycemia. Some doctors were even worried that there was something greater going on. But really, these diagnoses were so related to the symptoms I was having, but didn't help me to understand how I could fix it. The only thing healthcare professionals seemed to be able to tell me was, you have this diagnosis, so you need this medication. I actually remember one doctor's appointment like it was yesterday. I had ended up in a cardiologist's office. Honestly, it was a very well-revered cardiologist as well. Had a very fancy waiting room in Manhattan, really nice staff, covered by insurance, which I thought was incredible because of the specialist that he was. And he was friends with my other doctors. So I felt really safe going there. I was a healthy 22-year-old in a cardiologist's office with no heart condition. I remember thinking, how the heck did I end up here? What am I doing here? Well, how I ended up there was that I had already been to one gastroenterologist, two primary care doctors, a psychiatrist, two endocrinologists, one ENT, one neurologist, one rheumatologist. And this is where they had sent me after all of that. I had already been prescribed IBS medication, anxiety medication, anti-inflammatories, birth control, and I actually didn't take any of it. I refused to take any of it because I would not take a medication without understanding why it would be prescribed. And up until that point, I hadn't heard a good justification yet. Every single doctor's office I went to, I was met with a new diagnosis. At this point, I was a walking diagnosis. I was carrying my bag with 10 different diagnoses and 10 different prescriptions for medications that I would never end up taking. And I was always left with more questions than answers after every single appointment. So I got on the scale there as per the protocol, shaking, uncomfortable, and I was instantly dizzy and nauseous because that's really what most of my days comprised of. I felt like I was going to faint in that office, and I had been feeling that way for weeks at that point, every single day, honestly, specifically between the hours of 8 and 12 p.m., which prompted the cardiologist to tell me all about how I should lose 5 more pounds in order to be in the healthy weight range, and that my symptoms would be less if I were in that healthy weight range. LOL. Spoiler alert, I will later find out the exact reason why I was having these symptoms was because of my rapid weight loss. So not only did this not treat the root cause, it would have exacerbated the symptoms. This was a dangerous appointment, in my opinion. I went in nervous and dizzy about the experience I was having, the symptoms I was having. My blood pressure was chronically low at the time. And the cardiologist gave me 3 recommendations. 1, lose more weight. 2, don't eat meat, even though I was vegan at the time, but he hadn't asked. And 3, take a blood pressure reducing medication to help with anxiety, even though my blood pressure was chronically low. Honestly, I thank the universe for this appointment because I left there thinking something is terribly wrong here. Every recommendation he gave me was cookie cutter and worked directly against what I needed. I needed higher blood pressure, more meat, and to stop losing weight. I left that appointment knowing there were no answers for me in that office because he had pulled out all of his tricks already. And if the recommendations weren't going to be individualized, they weren't going to work for me. So I refused to accept that I just had all these new diagnoses and that they popped up out of nowhere. I couldn't understand how all these conditions that I never had before suddenly were there, and now I had to manage them for the rest of my life. It just didn't make sense to me. I also felt like I'm Michelle. I'm not a diagnosis. There's more to me than what these doctors are telling me. I was not my IBS, anxiety, reflux, hypothyroidism. I was a whole person. And I had a sneaking suspicion that all of these symptoms were actually related. I also knew that these were just symptoms, and I hadn't gotten to the real reason they were all happening. So I ultimately went and sought the help of a naturopathic physician and some functional medicine doctors who, during that naturopathic physician appointment, really sat with me and got to know me. He helped me to understand what my body was going through and was actually from a lack of nutrients, not too many. He let me know tangible tools I could use to rebuild my lifestyle and my health, and he asked me questions I had never been asked before. Sometimes I didn't know why he was asking a specific question, but I answered anyway. Ultimately, all of that information was extremely useful. We chatted for about 90 minutes, unlike the 5 minutes I had spent with other doctors, and really he kind of drew this puzzle of my overall health. He didn't judge, shame, or gaslight me. He listened to me and he really heard me. And from that appointment on, I started healing. From the first minute of the appointment, I was sold. It was like I saw the light for the first time. This is medical care. This is exactly what it's supposed to be like. And this is how I'm going to heal. And heal I did. My first appointment with a great ND was the inflection point of my mental, physical, and spiritual health. And since then, I've devoted my life to helping clients use this client-centered functional nutrition approach. Every single appointment you leave, you should leave feeling like this, like an aha moment is going off in your head, like the skies are opening up and the angels are singing to you. That's what it should feel like. Like you went in for a specific reason and left with peace, answers, and a heightened sense of awareness. Like you're healing from the moment you sit in that appointment. Sitting with a practitioner who cares is one of the most important components of healing. You quite literally start healing the physical part of yourself the moment you sit across from a practitioner who cares. Think about that. And I really want to help you feel great from all of your appointments, because it's not only the practitioner who has to feel great and who has to be great, but you have to show up prepared as well. Not every single practitioner you work with is going to be operating under the guise of functional medicine, of naturopathic medicine, and will know exactly how to navigate this appointment with you. Now, in this, I am not trying to change the entire medical system. What I'm trying to do is arm you with the tools to get what you need out of the appointment. So that's exactly what we're going to do today. I'm going to teach you how to leave your appointment feeling great. Not only do some of my clients feel like they're not getting answers from their medical appointments, some of my clients even feel that they're scared to walk into the appointment in the first place. So that could be because of being weight shamed when the appointment has nothing to do with weight, of being gaslit about their symptoms. Well, I know you feel this way, but that's not normal and not a side effect of that medication. Or they're afraid to hear answers that they don't want to hear. So one of the most important things you can do to prepare yourself for any appointment is to get your body into a really calm state before you walk in. So do whatever your favorite meditation is. You can do some deep breathing. You can do some box breathing, 4-7-8. You can meditate, do some gentle movement, anything that helps you to feel into your body to prepare for the appointment, and understand and repeat to yourself, I'm here for me. I'm here for me. This is not a competition or a battle with another practitioner. This is you trying to be heard. And the worst thing that can happen is that you aren't, in which case you'll find the practitioner that's right for you. And I might be able to help you do that. Remember always that you are the expert of your own body. You're the only person who knows what you've been experiencing. You're the only person who has your distinct goals, and you are the expert. The expert is not the expert, you are. So you're the most important part of this appointment, because some of the answers that you're going to be seeking, you actually can pull up yourself. So the most important thing you can do when preparing for any doctor's appointment is to collect a better understanding of yourself. And I've attached a PDF for you to be able to do that. So in this PDF, which is going to help you with a tangible piece of paper to walk into every single doctor's appointment with, and I mean, I literally want you to print this out and write on it and bring it into every single doctor's appointment you have, regardless of if the appointment is for one little tiny symptom or all of your symptoms. You need to lay out the big picture for these doctors. Remember, not every doctor is trained in root cause medicine. Not every doctor is going to look at the full picture, but using this form will actually force them to. And really what I want you to think about going into the appointment is what you're looking for help with and what the ultimate outcome you want from the appointment is. Then I want you to just really write down underneath that every single symptom you've been experiencing and for how long you've been experiencing it. So for instance, if it's something like your head, you can write anxiety, headache, where in your head you're having that, how long it happens, and how long you've been experiencing it. So kind of start at the tippity top of your head and work your way down. Oh, I used to have ear infections, I have TMJ, any symptom that comes up, oh, acid reflux here, whatever that symptom is, I want you to write it down and how long it's been happening. Then we'll start to build a bigger picture of your health. What's not a great idea walking into these appointments is walking in with a proposed diagnosis. And what I mean is, don't use Dr. Google and then go into these appointments. You are free to use Dr. Google anytime you want, and I understand why you've done that. You felt scared, you wanted answers, and you wanted to feel better. Doctors can't really use the information that you get like, oh, I was Googling all of last night and I'm sure I have a parasite now, because they can't start with a diagnosis. They need to start with a symptom. They need to start with what's going on with you. And that's the magic of doctors. They actually can treat whatever the symptoms are. And hopefully this document will help them to use and look at the big picture more than just one symptom. So bring this with you to every single appointment you have, print out a bunch of copies, and let the practitioner have them. For your safety and comfort, you need to set boundaries with your healthcare professional. I know that one of the biggest, stickiest sources of intimidation and discomfort in practitioners' offices is conversations about weight, especially when we have all of these potential negative relationships around weight and really true trauma that we've experienced due to diet culture or just due to having a personal relationship with changing weight that has impacted your life. You have every single right to advocate for yourself here and set a boundary. You do not need to be weighed in every single medical appointment. You do not need to report your weight in every single medical appointment, especially if what you're talking about is irrelevant to weight. So you can actually say, I choose not to be weighed and not to discuss my weight in this appointment. If there's anything else that you need to advocate for yourself, I am empowering you to do so. You have every right. You are the patient. You are the client. You are there for you, not to make the doctor or practitioner happy. You're there to help yourself. so you can set any boundary you need. You can also say, I am not going to take any medication without explanation of exactly what it's doing and how it's helping me heal overall. You don't have to take any diet recommendation from a doctor, from a nutritionist, dietitian, without explanation. You are entitled to explanation for anything that is prescribed. This idea that practitioners are experts and that you have to do what they say is wrong. You are in charge of your healthcare, and you are entitled to set boundaries for anything you need. Think about what those hard and set boundaries are before the appointment and write them down for yourself. If you need to announce them when you go into the appointment, go right ahead. You are entitled to. And if a practitioner won't work with you because you set good boundaries, you know exactly how to walk out the door. Feeling sick can make us lose our confidence about our ability to heal ourselves. But I want you to know you have all the tools you need to begin your healing journey. And if you go into every single doctor's appointment with these tools and go in with the confidence that you are the expert of your own body, you will leave every single appointment feeling better than when you walked in.